My earliest memories have been in glasses, which I later learned was since I was about 15 months old. A lot of the physical challenges were overcome once I started wearing glasses, but emotionally it was definitely tough starting school. The kids would always make fun of me for my thick glasses, especially when I got braces too, because then it was just both at the same time. I never let it bother me because I just knew that without my glasses, I wouldn't be able to navigate the world at all. So, you know, I just always felt really lucky that I had them. I think maybe once I got into my preteen years around middle school, that people would comment, you know, oh, like, you must be blind. And, you know, we'd swap glasses and they'd be in shock after putting my glasses on. It's how I see the world, so it's just completely normal. I thought everyone that wore glasses had the same issue. You know, it's not just blurred vision, you don't see anything. So, you know, facial expressions, shapes, everything, it just, it blends just into waves of color. Almost like seeing underwater, I guess. So once I started wearing glasses, the doctors were very adamant that I had to wear them all of the time. Not only because of how bad my vision was, but also to stop my eyes from crossing inward, as I could risk losing vision in the eye that crosses if I do it too much, or sometimes it can just stay crossed. When I don't have my glasses on, I almost feel detached from everyone around me and from the world, because it's like you're just behind this veil of blurriness and absolutely nothing is familiar to you. It's terrifying. So my journey to Dr. Benaim, shortly before I moved back from Orlando, I was kind of looking at different eye opportunities that were down here closer to my granddad. And I saw Dr. Benaim had posted that he was looking for a scribe, and immediately I started looking into it. I started looking into him, and just seeing the level of admiration that he has, you know, both professionally and from the patients, it drew me right in. Shortly after I started working with Dr. Benaim, I started noticing each week that we had all these patients that had just had cataract surgery the day before, the week before, and they were going from these really high prescriptions or these horrible visual acuities to all of a sudden 20/20 a week later. You see results the next day. It started to pique my curiosity, and one day I finally got the courage to go to Dr. Benaim and ask if maybe that would be something that would be good for me. And he responded by saying, you know, high hyperopes like you are my happiest patients. You know, they don't see close up, they don't see far away, they just don't see anything. He invited me to come to surgery with him to watch the cataract procedures being performed. And I got to be just right over his shoulder, leaning right over the surgical field, and see under the microscope the amount of detail and all the, you know, technique behind making this happen. And I couldn't even believe what I was seeing. You know, I think most people get a little bit squeamish about, you know, we talk about cutting an eye open, people get uncomfortable, but for me, I just was so fascinated. I just knew that I would not be able to trust anyone else more to touch my eyes than Dr. Benaim.
Now, Jodie, as you take your glasses off, okay, we just finished reading right down to the very small bottom line here, just to kind of reflect on how thick your glasses are and how blurry your vision is without them. I'm sure you can't see any of the letters. Can you tell that there's a chart on the wall?
Yes, I can see that there's a white square that's a little bit of a different color than the wall. And it looks like there's some black smudges on it, maybe in some kind of pattern.
Can you see our logo on my shirt?
It looks like a teal smudgy circle.
And then just looking at me, if my voice wouldn't be heard, can you tell my gender?
No.
Okay, you can tell that I'm a person standing here though?
Yes.
And you wouldn't be able to tell, you know, what flavor.
If you were still and quiet, I wouldn't be able to tell the difference between you and a mannequin.
Okay. it's obvious that your visual correction is absolutely 100% required for you to even walk about. Your vision is very, very blurry off the charts for distance, and it's even worse than that for up close. The axial length's a little bit longer in the right eye. In the left eye, the astigmatism, she probably is going to take a toric lens on this right eye. She's right at the threshold on the left eye. We'll make that decision when we see how her cornea changes now that her contact lenses have been out for a couple of weeks. The lens powers are high. We kind of anticipated that. Jodie, how are we doing?
Fine. Excited.
Get one set and then we'll get started, okay?
Now you're gonna see a red flashing blob in front of you. Okay. Let me know that you're starting to see that. Just right in the center. Look down a little bit. You're gonna feel that little bit of pressure now.
Here it comes.
Yep.
Don't move.
Hold perfectly still. No talking, no moving. Okay, you're doing just great. Hold perfectly still. Everything is absolutely perfect. That
All
went
finished.
perfect.
You did great. It's all done.
Perfecto, Jodie. You're out of here. All right, you did great, kiddo. Okay. Is it different?
Completely already. I can't even believe it.
I mean, if you don't like it, we can take it out.
All right, we're in the recovery room. You're all done.
Yeah, it's already so much clearer.
Yeah, of course. All right, we did good. All right, what a team.
Thank you so much.
You'll be in the office at noon?
I do remember like the second like everything was done, like I was sitting in recovery, I'm like, oh my God, like I can see right now. Like I don't even think I put my glasses back on. Actually being able to like make out things and like reading things far away, I just couldn't even believe it. I'm like, is there something in my eye? Like, did they just put a contact on me or something? Like, insane.
How are you doing this morning?
I'm doing great. I'm feeling so much better,
Yeah.
and my vision's cleared up a lot.
Okay, you're a little more alert than the last time I saw you.
Yes.
Okay, and I see you don't have glasses on.
Yeah, I have a contact in my left eye, but nothing in the right.
Uh-huh. Nothing? I think there's an implant.
Oh, yeah.
Okay. Yeah. And so what's it like?
Oh my gosh, it's life-changing.
Yeah.
I just couldn't even believe like just not feeling worried all the
Yeah.
time and driving and just not even having to think about, you know, what I need to be able to see.
Sure.
Or,
We talked about, you know, the far-sighted situation that you were in with a +6 lens being so different from like if you were nearsighted. You know, you couldn't see anywhere clearly at all. You know, you remember the OR? You remember going through surgery?
Bits and pieces.
Yeah. You were getting wheeled out of the OR saying, I can see the OR. You're not the youngest patient I've ever done this on, okay? But you're, you know, getting close to it at 24. This looks absolutely excellent. Okay, the incision is, you know, well sealed. The cornea is very clear, and we can see the Odyssey lens in there. All right, I'm very happy for you, okay?
Thank you.
You know, now it's a tough act to follow. I got to do it again. Well, good morning.
Good morning.
How are we doing, Jodie?
I'm doing good.
Okay, so we are what now?
I
This
think
is
2 weeks in the right eye and a week in the left.
okay. So a week on the left eye, and we're doing fine. What most all activities are getting done without glasses?
Everything.
Yeah. Okay. Well, that
Yeah.
smile says it all. What's the most dramatic thing to you that's different, like in your daily activities around the house or whatever?
Well, the biggest thing is normally if I woke up and I could see, it meant I slept in my contacts. But now it's like I wake up, everything is so clear. Driving, it's probably the biggest difference.
Okay.
My contacts aren't getting dry from the AC.
Yeah. You don't have to pull over when they pop out like you told me about.
Yes.
Okay, so let's go ahead and get a look at things.
Okay.
And just look straight ahead at me. Everything looks just like it's supposed to. The anterior chamber is nice and deep. Implants perfectly centered and in position as it should be. And the wound is healing well. And probably the most notable thing is I don't see any contacts. Okay, but the implants look great. Well, you did great. Everything is perfect, and I will see you in about a month, okay? As an exam, okay? But obviously, I will see you day in and day out here.
Yes,
All
and
right.
I'll finally see you.
All right.